So welcome to our session. My name is Basil Daher, and I'm one of the co-chairs of this working group, the Pathways to Zero Hunger in the US. I'm based at Texas A&M University. I'm an assistant research scientist at the Texas A&M Energy Institute and an adjunct assistant professor at the Biological and Agricultural Engineering Department. I mainly work at the intersection between water, energy, and food security with the goal of creating environments for more collaborative interdisciplinary research and stakeholder engagement. Asma, do you want to go ahead?
Sure. Hi, everyone. My name is Asma Latif. I'm also co-chairing this working group with Alicia and Basil. I am with Bread for the World Institute and also the SDG2 Advocacy Hub.
I'll jump in as the final co-chair, I guess. I'm Alicia Powers. I'm with Auburn University. Specifically, I serve as managing director for Hunger Solutions Institute. And we oversee a couple of international networks focused on addressing SDG2 in institutions of higher education.
Todd, would you like to introduce yourself?
Sure. I'm Todd Post. I'm with Bread for the World Institute, colleague of Asma's, and that's about all.
Madrad? Or Laura?
Muting my system. Can you hear me now?
Yes, we can.
Oh, good. I spent the whole time trying to get the video to work. And anyhow, I run an organization called Earth Game. It's basically a research and education organization that deals with the Sustainable Development Goals and a variety of other odds and ends. But it's mainly one of our areas of great interest this year is the global food system and the US food system, hence my presence in this group.
We're very glad to have you with us, Madrad. Laura, would you like to introduce yourself?
Yes, I'm Laura Carson from Prairie View A&M University, not too far from you in College Station. Yeah, I am a director for undergraduate research there. Just looking for ideas, maybe collaborative efforts for our students to get engaged.
Great to have you with us, Laura, and hope it was an easy week for you with all the snow we've been getting in Texas.
Yeah, pretty rough.
Yeah, it was a rough one. So let me start by sharing a few slides that we've prepared for this session. So the goal of this session really is to give you a quick overview of some of the work we've been doing for the past year as part of this project, and to have the chance to engage with you in a dialogue and discussion around some of the questions that we're facing as we progress in this group. Let me get started with a bit of the background on the vision and kind of focus of this group. So we're looking at this through this project to develop a collaboration that applies systems approach to ending hunger in the US. And through this collaborative, we are interested in focusing on four values: equity, resilience, health, and sustainability, to develop different pathways to improve the availability, accessibility, utilization, and stability of health and food for all. So one of the challenges we've been facing and that we face today, and that we see in current approaches addressing hunger, is a lot of focus on access to sufficient calories with little attention to the quality of nutrients that are available, accessible, and utilized by low-income households. So we usually see a lot of emphasis on food assistance, which is very important, but not necessarily a lot of emphasis on addressing the underlying causes for hunger. So with this working group, or this project, we're looking to really dig at some of those underlying causes for hunger and think of different pathways, interventions in the short term that could involve and focus on more food assistance type interventions, as well as more longer term interventions that could really focus on the underlying causes of hunger. In terms of the objectives for our group, one thing we're focusing currently on doing is developing a baseline reporting for the current situation of hunger in the US. So kind of developing a situational analysis for hunger, giving an overview of the key statistics, geography of hunger, causes, historical context, consequences, looking at health impact, overall human development, perpetuating inequities, and some of the current responses we're doing related to the Farm Bill and different food assistance programs, including SNAP and others. Second, we're also interested in identifying what kind of interventions and possibilities are out there that we could work towards, and in order to build towards that, we are interested in engaging with experts from across different disciplines and multi-stakeholders as well, which would be necessary to identify the multifaceted solutions that are required for addressing such a complex challenge. And third, how will we evaluate them? So now, after we had thought of different policy, technical, social interventions that we can make, how could we evaluate those interventions and their impact on improving food security and the current status of hunger in the US at different scales? And last but not least, how could we link those research-based recommendations to policy action? How could we really translate that science and these recommendations into action? So to give you, this kind of sums up our approach that we are taking with this project. Again, building on the 4 pillars, the values that we're working towards. So we're looking at a system that is resilient, equitable, healthy, and sustainable. And through the engagement of multidisciplines and multi-stakeholders, we are looking to think of different policy, social, technical levers that could help us move towards improving those goals or values. How could we make our system more equitable, healthy, sustainable, and resilient? And we're going to do that through using different tools of research, engagement with different stakeholders, as well as education and capacity building. In terms of our timeline and the deliverable, we've been meeting for the past several months, and some of the upcoming milestones that we have on our list are, in addition to the putting together the situational analysis report, we're also interested in or working towards launching a dialogue series whose goal would be to bring together cross-disciplinary groups of experts to discuss issues related with hunger in the US, rooted in the same 4 core values that I shared with you: equity, resilience, health, and sustainability. And the goal of these dialogue series would be to really come up with a list of policy recommendations at the end of each of these sessions, in order to share that with different policymakers on these topics. And some of these potential dialogue topics, which we'd also like to hear your feedback on, is what does it mean to end hunger? How could we identify between or focus and leverage different approaches that are food security and nutrition security centric? What is the true cost of hunger and unhealthy diets, and leveraging health procurement, school systems for zero hunger and nutrition security, and focusing on equity. So these are some of the potential dialogue topics that we're looking to have in the coming few months. And the format of this dialogue series will be that we bring in experts on these topics of interest, and then have a discussion with the wider community around these topics, again, to end up with some clear recommendations that we could take into policy discussions. In terms of the roundtable discussions, I think Alicia would like to help maybe moderate this segment, but we're interested to ask you about some of the salient and pressing issues that need to be considered that you think might not be covered by the approach we just shared with you. So some initial feedback on the approach and some of the salient pressing issues you think our dialogue series could cover. And what do you think are some of the barriers for cooperation across sectors and multi-stakeholders that you see from your perspective, from the institutions you sit in, and from your experience? And as we look at working towards achieving these values and improving our system towards these values, what are some of the key trade-offs that you see in this presented approach, and as we work towards these different goals that might be conflicting in some respects? I'd like to stop here and would like to ask first Asma and Alicia if there's anything I didn't cover which you'd like to cover, and with that maybe we can start with the roundtable discussion.
You did a great job, Basil. Thank you. Alicia had to jump off for a few minutes, so she said she'll join. She had a phone call. She'll join in a few minutes. But mostly, thinking as Basil said, one of the things that we hope to do is create a series of dialogues between key stakeholders within the SDSN network and broader. And so, with these questions, we really hope to hone in on some of the key topics that we should be organizing these dialogues around. As Jeff mentioned and as Basil mentioned, there are some short-term opportunities around this issue with upcoming appropriations bills and the rescue package, but then there are some longer-term questions. And so thinking about what are the key issues that we need to really grapple with as a community, so that we're really reflecting the best thinking out there on hunger issues, and thinking as in a systems approach. So that's the only elaboration I would make. And with that, maybe we just open it up, and these are questions we put together, but if there are other questions that you think we should be thinking about, we welcome that as well.
So are there any initial reflections from the group regarding the approach or regarding some of the topics that you think we should consider for the dialogue series as we plan those in the coming few months?
I have a question if I can jump in, and
sure.
Apologies, I think for everyone else in the team, in the group here, I'm part of the SDSN team, but I do have a question. Thank you for your presentation. I guess my question is around who is the intended audience of these policy recommendations that you're hoping will be the ultimate outcome of this work? Is it, are you looking, like at what level of policy making are you looking? Are you hoping to be able to, is this you're looking nationally, or are you looking to have sort of broad guidelines that can be localized? Who's the audience for this?
Would you like to answer that, Asma?
Yeah, that's a great question. And we were thinking about all levels, federal, state, and local. It was interesting just listening to the mayor's presentation around the Marshall Plan for the Ohio Valley and Appalachia. you know, they're billing it as a economic plan. But the issues, I mean, it's a region also that has very high levels of hunger and malnutrition and very poor health outcomes, which he did allude to. And you know, it's so clear that poor nutrition, hunger really are, have a huge impact on future viability, economic viability. You can't have a strong economy without really well nourished and well educated workforce, and a productive workforce, which depends very much on health and health outcomes. So it's sort of, you know, we are looking at how we can make that case at the local level, at the regional level, at the state level, and then at the federal level, obviously. At the federal level, there are some key opportunities, you know, with, for example, the COVID response bills, but then also thinking ahead to the Farm Bill. And, you know, there are lots of opportunities around, you know, additional efforts to strengthen the Affordable Care Act to, you know, connect some of these things. You know, it's with the way the Biden administration has approached climate change, almost every department has a climate mandate. How can we have a similar approach to hunger? You know, a whole of government approach to hunger, and malnutrition. So that's sort of along the lines of what we're thinking. And I think one other comment, if I may, we did, you know, we were developing this project with the backdrop of the COVID crisis and everything it revealed about the weaknesses in our food systems, the inequities that are built into our food system, and the way COVID struck, you know, the health inequities and health outcomes. So, you know, that was part of our, you know, building out those values was very much in response to, you know, what we were seeing play out right in front of our eyes last year.
If I could say something, can you hear me?
Yes.
Okay, so the question about who's the audience, I think is really important, and I agree with all of your target audiences, but I want to throw in what I think might be another one. The original food stamp program came about because of a book by Michael Harrington, something about, you know, poverty in America. I think that was the name of it, or The Other America, something like that. And it became a bestseller. It was, you know, a book that nobody, I don't think he expected it to be as big as it was, but in today's terms, it went viral and it became a bestseller, and it moved the country. You know, it became a debate in presidential elections. And Harrington, you know, some people say, well, he was the source of Medicaid and Medicare, as well as food stamp program. All right, so I think, and part of the origins of that book was a study that documented, you know, with incredible evidence that there is not just hunger, but almost near starvation in certain parts of America. And that was Harrington did such a good job at presenting that information that it outraged people. And I think that part of the data that you will be gathering needs to will document that there is hunger in America. And I think you need to have part of the audience be not just the policymakers in Washington, D.C., or at the city level or the state level, but also the general public. You know, if you can figure out a way of getting people as angry as they should be about the moral outrage of a hungry child in this wealthy, super wealthy country, I think you'll light a bonfire that will move the politicians that normally, you know, don't move on hardly anything. Even the Republicans. So I would urge you to think about, at least spend a little bit of time thinking about how do we get this incredibly valuable information and perspective out to the rest of the world, to the general public.
Do you have any suggestions? Obviously, I think a report that captures the imagination, the way the Harrington book, but you know, Laura and Shannon, Todd, any suggestions on how to do that as well?
One of the things that came out in 1968, right at about the time this was happening, was a documentary that I think CBS did. You know, Netflix and Amazon are the CBS of today, and I think it was Hunger in America was the title of that documentary. You know, I'm sure you can go see it on CBS, but I would try to urge CBS to update it, Hunger in America 2021 or something, or go after, you know, somebody else with deep pockets these days to make a TV. I think CBS did this because of the book that was out there and had a lot of, all right, so that's an idea. Another one is something I did years ago having to do with gun violence. There's a lot of data out there about gun violence, and it's fairly, one of the problems with the Sustainable Development Goals and statistics in general is they're meaningless to the general public. When you say there's, you know, 820 million people in the world who are hungry, well, 820 million, what does that mean? You know, how big is that? You know, is it a city the size of New York? No, it's, you know, 10 cities the size. It's, you got to figure out a way of translating big numbers into something that is emotionally resonant with people, something that they see, can hear, feel, touch. Anyhow, back to the gun violence thing. We had a data visualization contest. We had all the data. You know, here's how many people are killed every year with guns, how many guns are sold, all of that stuff. And then we said, okay, here's a contest. Take this data or a piece of it and do a graphic about it. I mean, you can get a PhD these days in data visualization. So there's a pool of talent out there, from high school students to, you know, college grad students, as well as the artist community. There's lots of people doing data visualization. And I would urge you to have a contest, you know, offer to publish the stuff, you know, everybody's looking to get their stuff out there, but also throw some money at them as well, if you've got it. But those are two ideas of trying to get this stuff out to the world.
Those are great ideas. And given that this is a project of the SDSN, and most universities probably have some film program, there may be some opportunities to partner with some of those departments, but then also students. Laura, you were asking what students, undergraduates could do or students could do. That might be something really for us to think about. So thank you for that. Todd.
Thanks for bringing up those. Those have always been, those two, the Harrington book and the documentary in '68 have always been touchstones for me. I think Robert Kennedy's trip to the Mississippi Delta, also late '60s, was really powerful. These were really galvanizing media that led to a lot of, you know, the nutrition programs that we have today. WIC was created in part because of that. School breakfast. The food stamp program, yeah, it got a lot better. It sort of existed, but it got a lot better. And those programs really did sort of solve a lot of the problems. We don't have hunger like those, you know, that Harrington described and like the 68 documentaries. We don't have, I mean, we had stunting, we had wasted kids. We had literally people dying of hunger. We really don't have that anymore. I think the problem, we don't really need more movies about hunger. We've had them. They're out there. I mean, you know, A Place at the Table, a few years back. I think the issues are much more complicated. It's really not about hunger alone. It's about the food system. You know, and that's part of the messaging of this, of you know, the group is, I'm not sure if it might be counterproductive. Hunger, you know, when you talk about hunger and you talk about bad diets and you talk about malnutrition and all of the effects of malnutrition, they're kind of related, but they're not really, the solutions aren't necessarily the same thing. I mean, you know, hunger is not a hard problem to solve. Hunger, you know, not having enough food and go, you know, starving at the end of the month. You know, that's really what happens in the United States is, you know, people get SNAP and it runs out 2 or 3 weeks before the end of the, you know, before the end of the month, you know, I get about a week or two, and people go hungry, you know, and they go to, you know, food pantries, and hunger is not a hard problem to solve. You just give people money. It's that simple. You know, when I go to the grocery store, if I don't have the money, I can't buy the food. You know, it's that simple. But if you start to care about the diets and what people are eating, that's another issue. And that's not just an issue of hunger. Because most of the country has really bad diets. It's not just poor folks. In fact, they don't really eat any worse than anybody else until they really run out of money. And then, you know, it's the feast or famine cycle, you know, when you're just eating, you know, bags of cheap food, you know, potato chips to fill you up. The issue, you know, is the food system, the food we produce that, you know, as Jeff Sachs was saying earlier, that contributes to the terrible diets and all the health problems that causes. So you have to look at the thing as a system issue. And that's not something you can just make a movie about. You have to, you know, you have to figure out ways of conveying that message. Now, I think what's really important, you know, is I think climate is really important because the focus is on food system. You know, the food system now, if you've been following sort of the international conversation about food systems, I see this really as a way of bringing, you know, all of the issues around that were, you know, that the food system is doing to our health with climate, which the climate is, you know, climate change. Agriculture is both a victim and a perpetrator of the climate crisis. And the food system brings those together. Now, people are much more tuned in now to climate. Look what's happening in Texas, right? The fires in California. You know, to a lesser extent, people are aware of the weather that you know, devastated cornfields in Iowa over the summer. People are really getting the climate piece. And so bringing these things together and leveraging the things that are you know, that are happening. I think at this stage, people are much more concerned about, you know, the health effects of the food system than they are, you know, the fact that some people don't have enough food. COVID has sort of brought that into, you know, brought that much more into focus because we've all seen so many people, you know, lining up at food banks. But, you know, when COVID ends and we're back to normal, we're still going to have these food system issues that are going to be killing us, both climate-wise and health-wise.
That's that's a great point, Todd, and this is really at the heart of our approach, the way we're approaching this challenge, or hoping to do so with this group. But one one challenge that we face often when we look into such challenges from a systems perspective is you start looking at how this challenge is connected with others and with the different players that are connected, different decision makers across different sectors, across different areas, and how do you create the right environment to ensure that those decision makers across vastly different sectors coordinate, cooperate, develop integrative plans, given that the way such plans are developed today are very much under different ministries, departments, different silos that do not necessarily talk to each other or coordinate at a level that is consistent with how interconnected these challenges are.
Yeah, it's really, I mean, obviously you need leadership. I thought, Asma asked a question earlier in earlier in the day to the White House representative. I was really stunned by the answer. Asma asked about the food system and how is the food system conference, the UN Food System Conference. And what I'm sorry, I can't remember her name, but the answer she gave was that John Kerry would be there and take care of that. I mean, in other words, they're saying that we see this as an international issue. We see this as a development issue. USDA has to be there. It's not just what we can do for low-income countries, in Africa or Asia. We have to make those changes here. I mean, even what the food system we have, the agricultural system we have, is driving climate change. And if we don't change that, giving a few millions of dollars to Kenya is not going to make probably going to make a bigger difference in the long run on climate if we get our own agricultural system in order. So it's very disappointing. I mean, so, we have to inform these people, have to make sure that they understand that this is, you can't just silo these issues.
And but perhaps goes back to the definition of hunger. How do we define hunger? And are we giving the definition of hunger a systems perspective, a systems lens, or are we looking at it only from, again, a calorific view and looking at, as you mentioned, Todd, that money is basically the answer to allow people to buy food and not be hungry. So what kind of definition are we following when we look at putting forward these strategies to address hunger? I think is a critical one to figure out as well. I'll just say, I don't want to monopolize this, but in about the mid-2000s, USDA puts out a report every year on the state of food insecurity, the state of food security in the country. I read that thing very, very carefully. And my dog is here. He may stop barking in a minute. In the mid-2000s, they used to say, they broke down, are you, food secure, or are you really food secure? They call it very low food security, really horrible tone. But it used to be called food security with hunger, and they got rid of it. And there was an outcry among people, mainly people in our field, but the public, in the public, let me get rid of this dog here.
One thing that concerns me is if you give people, simply give them money and say, go and buy food, they will go and buy food, but it might not be the right food. It may not be nutrition. And I think if you're going to give them money, you also have to educate them about the nutritional value of food and making healthy choices with food.
Well, nutrition, dealing with the malnutrition is a whole other problem. I mean, this is not something you solve overnight. I don't think you can solve it by 2030. I mean, you have to deal, you have to go into like the school systems and say, we're going to teach, the food system to kids. We're going to teach them about healthy food. and they're going to grow up with that. And then, you know, it's going to be part of the lunch program. It's going to be part of the education, you know, the classes they take in health. And hopefully, you know, it will sink in.
Well, it's not just teaching the students about it. It's the getting those students to have a conversation with the parents, because they're the ones that purchase the food. And so, so it's
and that's what, you know, sorry, as we were saying, you know, as we were thinking about this, I think there's a role for policymakers in education as well. And so, I mean, what are mayors doing to educate their communities about good nutrition? I think that education point is really important, and it needs to be, you know, we need to think about it in every part of life. And the private sector has been really good about educating around junk food through advertising, but we as a nutrition community, we haven't really figured out how to do that. So that's a really good point, Laura.
Well, actually, you know, the 1862s and the 1890s, they have an extension program, and in those extension programs, they talk. There are units that talk about nutrition, and they go out to the different populations. Like the 1890s may go to the underserved population, and the 1862s may go. And I think you guys, Basil, wait, it's 1862, right?
Yes, I guess so.
Right.
Yeah.
And you have an extension unit that goes out to the different populations.
Yes, with AgriLife, yeah.
Yeah.
I don't want to poo-poo I mean, you know, I think education is really important, but I don't think we should overstate it, because the WIC program includes nutrition education. You know, 80% of low-income, people who qualify, you know, at the infant level, you know, the point is there's a lot of nutrition education in WIC. People get nutrition education in WIC, and many of those people, after they're finished with WIC, they're on SNAP. But the food system, the foods that are in the stores are mostly crap. They don't have the money to buy the good stuff, and their kids are sold stuff on TV, Captain Crunch, and the whole food industry is trying to defeat whatever we got out of that education. So we can educate people, but the forces to undermine that are really, really powerful. The industry, is mainly trying to make money off of the food they sell, and they know that the stuff that sells is the processed stuff.
Within this context, one of the questions we're trying to work on as part of the situational analysis is why an unhealthier diet is a cheaper diet, and why is it more expensive for people to eat healthy? And it goes back to that. Yeah, I mean,
it's what we subsidize. We subsidize corn.
Exactly. So how could we better subsidize in a way that ends up with better outcomes? Because if we think of the cost to society we have with the current system, when we look at the different cost of healthcare, effect on education, etc., with people eating unhealthy food because that's the only thing they can afford, then no one is doing that or basing incentives and policies according to that cost benefit analysis, but we're more interested in more short-term policies that are building on shorter-term cost benefit analysis that are not looking at the holistic picture and the costs that are often externalized or treated as externalities.
I think I'll let other people.
I just wanted to note that we have 15 minutes left, and we just got a note in the chat to make sure that someone from this group here is designated to give a quick summary discussion in the full group, the regroup. So carry on. Just wanted to point that out to everyone.
So we need to give a summary after we close this session to the full group. Is that
tomorrow?
Oh no, tomorrow.
For tomorrow, okay.
So there's a wrap up tomorrow.
Yeah, yeah.
Any volunteers to do that? Otherwise,
I don't think there's any volunteer. I think we can nominate either Asma or Basil. One of the two of you seem to be the folks that have been here the whole time. Before we go down that road, though, I'd like to just say something about education. I totally disagree with the notion that just because there's been education with WIC or SNAP and it hasn't been effective, people haven't changed their mind about what kind of food they should eat. Just because there's been that ineffective education doesn't mean education is invalid. I think we need education that works. Obviously, the education that comes with food stamps isn't working. If it doesn't lead to more informed consumers that are valuing the quality of food that they're eating so that it's more nutritious and that they're immune to the hype of the food industry, then I think it's not an indictment of education, it's an indictment of ineffective education, A. And B, obviously all of this stuff is interconnected. You know, you pull any string and you're going to run into, you know, energy or climate or health, you know, all of the whole system. Yeah, it's a system, and it needs to say that because it's complicated, you shouldn't try to reach out to the public and give them some information about the complexity, I think is bogus. I think you need to reach out to the policymaker with effective, workable policies that create jobs and are cost effective at a city level, a state level, and a national level. But you also need to reach out to students, young students, middle school, high school students, and the general public to get them all on board. Everything, like I said, is interconnected. So is the outreach and the results. Otherwise, it's just you're going to be speaking to the already converted, you know, to the choir.
That's why I was quite excited about this project, because it is an opportunity to engage at least undergraduates and graduate students around some of these issues in sort of their formative years, because I think you're right. And thinking across sectors, and we really have tried to build that into our project design. To look at trade-offs and things like that. Nikki, we saw that you joined, and would you like to introduce yourself? Do you have anything you'd like to add to the discussion?
Oh man, hi everybody. My name is Nikki Dutta, and I am not only a student at American University studying sustainability management. I am also a scientific program associate at a research nonprofit in Washington, D.C. I went on a run yesterday, so I'm icing my ankle, which is why I'm not on camera. But this topic of food education and nutrition is really interesting to me, and I'm just really excited to hear all of your thoughts and brainstorm together, along with building my network and seeing how, as a graduate student and as a young professional, I can make better decisions and hopefully impact to build a better, healthier future, which is very optimistic. So yeah, thank you so much, and I'm really happy to be here.
Glad you could join. Laura, did you want to add anything else?
Not really. When we were talking, I was thinking maybe use some kind of citizen science approach to get at some of those and gathering the data you might need.
Can you say more about that?
Citizen science approach?
Yeah.
I've been reading about it, and I think it takes into consideration the general public. It's in addition to the researchers. So the general public, I think maybe you guys may know something more about it than I do, but I think it allows the general or the the general public to serve as scientists and deliver data, as well as the research scientists. I have to read a little bit more about it, but I think it's an excellent approach to get the general population involved in gathering that data that you might need.
Is it sort of the kind of research that's being done now in settings where, you know, with mobile technology and things like that, that you're able to have surveys, real-time surveys, with people using their mobiles and things like that?
I think it's similar to that. Not really sure. I have to read some more about it, but I think it's more just of the general public. Like, for instance, if you consider doing a community garden, there's community gardens all over the place, and there is some kind of network where you can reach out to the different community gardens to gather information about, you know, what do they grow, what do they sell, what is the most likely thing to sell to that particular population that they're serving, and based upon where they are, where they're located, whether it's in inner city versus a rural area, whether it's in suburbs. Yeah, there we go.
Good example, Laura.
Yeah, there we go. Citizen, someone just dropped it. Okay, in the chat.
I think that approach basically takes the focus of developing research questions within only academics and researchers, but expands that to include the stakeholders to co-frame, co-develop the research questions, as opposed to having it being done exclusively within the academic environment.
Right.
So really engaging from project inception with stakeholders. And Alicia is with us, which is also, she's also our third co-chair. So would you like to introduce yourself quickly, Alicia, before we wrap up?
I introduced myself. I had to jump off for a brief call.
Right.
Okay. At the beginning, but
okay.
Laura, thanks for sharing that citizen science approach. Actually, I noticed you went to Alcorn. I was at Southern Miss and went there simply because I was able to learn community-based participatory research, which is the same thing. And that's pretty much all the types of research I've done. And I've worked with SNAP-Ed. And so I hear you, Todd, and others on the education piece. I will say a bit promising, maybe glimmer of hope, is that SNAP-Ed and FNEP and some of the WIC education efforts have moved beyond simply direct education and into the areas of policy systems and environmental work, which is going to be central to making sure policies and environments in the food system can support the education that any of the populations being provided. Because while, yes, I'm sure some education is effective and some is ineffective, it's going to be always ineffective if we tell someone to eat an apple and they have no accessibility to the apple whatsoever. And so there's obviously more funding that's needed, more best practices are needed, but some of the federal dollars included in the SNAP admin and FNEP and WIC admin line items, so it's different than the assistance part of it, is going to help fund some of those types of efforts.
Great.
All right. With that, I think we reached the end of our time, Shannon.
I think we have about 5 more minutes.
Okay, great.
If there's any last points to be made, but I think it sounds like every problem related to sustainable development, there are so many layers, and I think there's everything from the whole government policy approach down to the public education and yeah, I think this is a challenge that seems to come across in every discussion for any topic, which is that there's just so much to do. But I do think, just back to the earlier discussion about sort of media and public awareness raising and getting people really outraged, I think maybe a challenge now that perhaps didn't exist back with those earlier examples that were given is just the overwhelming amount of messaging that everyone's getting through social media, and the fact that you can curate your messaging in a way that wasn't possible with just like regular broadcast television. You kind of had to watch what was on. But I also think because of that, and especially because of COVID and how it's brought a lot of these issues to the forefront for so many people in a way, you know, that may not have been aware of them before. I think there seems to be a greater acknowledgement that these are problems, but I think what people need, I would say what people need to know is that there are solutions out there. So in thinking about the messaging for your recommendations or your end product, get public support not behind, oh wow, isn't hunger such a big problem? But hunger is a problem and we know how to fix it and it's not being done. And that's the thing we're outraged about.
Great point. Yeah.
Great reflections. We can't hear you, Medard.
I was just jumping on that bandwagon saying that not only is it a problem and we've got solutions, but they're affordable. They're not outrageously expensive. And in fact, in the, you know, not even the long term, but the midterm, they're the most cost-effective thing we can be doing to make sure everybody in the country has got a healthy diet that in terms of everything from longevity and infant mortality and all of the various diseases that we would be avoiding if we were eating healthy. The combination of health and diet is obvious, but also its impact on climate change. There are lots of solutions. And just last thing, given the number of colleges involved in SDSN, you might come up with some ideas, some solutions that a college could be doing, you know, in terms of making, when I was in college, you know, 400 years ago, one of the things that our university did was it had a big community garden for the community, and that it became things that students and the community were involved with, and we were producing food that was then allocated towards different parts of the community that didn't have the resources to pay for food. Anyhow, as a way of involving lots of people in the quote solution. But I would think that there's lots of things that a university can do that would help the food system in their particular town.
That's great. It goes back to the theme of being hyper local, as well as, you know, and how that sort of multiplies upwards. So that's great. Shannon, did you want to come in?
Oh, just I think on the question of education versus the food industry, and I think there's always this battle, and I think this kind of fits along political lines in at least in what I've seen, which is whose responsibility is it to fix the problem? And if you only focus on education, then you're making it the individual's responsibility to make better choices. Even if the food isn't available, then they should be going out of their way to find it because it's their responsibility. Or do we crack down and regulate the food industry so that the food is available and people can make those better choices? And then, oh, you're over-regulating private enterprise and you're causing a problem there. And I guess the answer is always, well, it should be both. But I tend to lean left in my political perspective. So I'm definitely on the sense of, the same way that there's a push to hold fossil fuel polluters responsible for climate change. I think that there should be a similar push to hold the food industry responsible for food insecurity, malnutrition, misuse of agriculture, and any other food-related problems, because just making it an individual's problem doesn't solve the systemic issues, is how I feel.
Thank you, Shannon, for all these great reflections, and thank you, Medard, for sharing the course information also on food and nutrition education, which I think that this is a valuable resource as well.
I'm with the SDG Academy, so if anyone has any questions about the course or any of the other resources, just feel free to reach out.
All right. With that, I think we're coming to the end of our session. Thank you all for this engaging discussion. It was great meeting you all, and hope to see you tomorrow.
Yeah, thank you.
Thank you.
Take care. Bye-bye.